Hello, family and friends. Today, we'll continue the discussion about colorectal cancer and focus on screening options. It is important to note that colorectal cancer can often be caught early or before it even starts. Screening looks for polyps in the colon or traces of blood in the stool that might indicate colon cancer. Polyps are unexpected growths of tissue in the colon. Most polyps are harmless, but some polyps can develop into cancer over time. A polyp can take up to 10 to 15 years to grow into colon cancer. Early screening can catch them before they have a chance to develop into cancer. Recent screening guidelines recommend anyone with an average risk of developing colorectal cancer should be screened starting at age 45. So what is an average risk for colorectal cancer? Your risk level is considered average if you have no history of colorectal cancer or polyps, no family history of colorectal cancer, no history of Crohn's disease or ulcerative colitis, no history of or suspected history of hereditary cancer syndrome, no history of previous cancer treatment in the abdomen or pelvic area. On the other hand, you may have an increased risk of colorectal cancer if you or a close relative had polyps or cancer previously, you have ulcerative colitis or Crohn's disease, your family has a history of hereditary cancer syndrome, or if you have a cancer, radiation to the abdomen or pelvic area. Now let's take a look at screening guidelines. The guidelines are determined by the age of a person and the time it typically takes for a polyp to develop into cancer. As mentioned earlier, a polyp can take 10 to 15 years to develop into cancer. So for individuals between the ages of 45 to 75, a colonoscopy is recommended every 10 years for the average risk patient. For individuals between the ages of 76 to 85, testing is based on an individual basis, and factors such as overall health, life expectancy, and previous screening history are taken into account. For those individuals over age 85, testing is not recommended. There are screening tests available that range from a stool test to a colonoscopy. The colonoscopy is the gold standard. It is both diagnostic and therapeutic, in that if a polyp is discovered, it is removed at the time of the procedure and sent for pathological examination. During a colonoscopy, a long flexible tube called the colonoscope is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to detect changes or abnormalities inside the entire colon. A colonoscopy takes about 30 to 60 minutes, and screening is generally repeated every 10 years if no abnormalities are found and if you don't have an increased risk of colon cancer. There are other tests available, such as a Cologuard. Join me next week when we will discuss the Cologuard test.